Alright guys, so we're just trying to look at some key aspects of hemorrhagic disease of newborn. This is the treatment, prevention, and possible complications that could come up. Alright. So hemorrhagic disease we have already spoken about is mostly called what? Vitamin K Deficiency Disease of newborn. So vitamin K levels are not high, so blood clots is kind of like what? Reduced. So the baby can easily bleed, you understand? And when they are bleeding, for the bleeding to stop is hard, you understand? So for active bleeding, you know that what? The primary thing that is lacking there is what? Vitamin K. So you actually what? Replace vitamin K. And you give this IM, that's intramuscularly, 6 hourly. When they say 6 hourly in a day, you give it 6. You give it now, you wait for 6 hours, you give it again. So fresh frozen plasma too, if bleeding is severe, that's cryoprecipitates, right? Then factor replacement, that's all those blood coagulation factors. If you can isolate them, you replace them, right? So surgical evaluation is if there's intracranial hemorrhage, you might want to what? Drain it out. Short bowel syndrome, hepatobiliary disease, all of this may actually now need surgical intervention. So administration of vitamin K to, okay, this is prevention now. We are looking at prevention. Now, how can you prevent excessive bleeding in a baby after the baby is being given birth to? So what? Administer vitamin K to infants at birth or to their mothers, that's before they deliver. Parenteral high dose oral vitamin K during periods of malabsorption or cholestasis. Okay. So complications is intracranial hemorrhage is one of the most serious complications of what? Hemorrhagic what? Bleeding. That's bleeding in newborns. So they can bleed into their skulls, and this can compress their brain. You understand? Leading to the baby dying. So complication of treatment is sometimes there might be reactions to the vitamin K. Sometimes hemolytic anemia if you now give vitamin K too much. Alright, sometimes hematomas at the site of what? Injections, like just swelling up of the blood, you understand? Okay, so I think that was it for what? This whole concept as related to hemorrhagic disease of newborn.